Ever since the global Covid-19 pandemic reached Papua New Guinea last year and has gradually changed the way people conduct business or move around in public places, the Marape-led government has been faced with tough decisions to make from day one, and not without pressure applied from the opposition, critics from certain professionals in the country, and from the wider general public, whether via social media, through organized conferences or conversation on the streets and at homes. The Marape government and relevant authorities such as the Covid-19 National Control Center, the National Department of Health and provincial health authorities have been working together with the aim of stopping the spread and infection of the deadly virus in the country, strongly encouraging people to take the vaccine, although the Prime Minister said in Parliament this week vaccination still remains voluntary.
Facts and statistics must assist common sense and decisions that we make in our country. Whilst we choose at the national level not to encroach into people's personal preference of vaccine, but at a level where we operate, we encourage people. Vaccines are available. In fact, our country was amongst the first to have vaccines in our medical system. Yet we choose not to be vaccinated. We encourage people to look at vaccine as a safety tool to ensure you are equipped.
When COVID-19 vaccines became available and COVID-19 variants like Alpha, Beta and Delta also emerged in various countries at the beginning of this year, Papua New Guineans got caught up in the dilemma of whether to accept COVID-19 vaccination or not in the backdrop of a strong Christian society. However, this has gradually improved over time, with some people deciding to get tested or be vaccinated, with queues piling up lately at designated locations around the country. Central Province launched their vaccination campaign yesterday at Gaire village, enabling many to take the vaccine. Compared to other countries, PNG still has a very low vaccination rate in terms of its population. After a spike in the number of cases and deaths recorded earlier this year, there seemed to have been a period of silence for the pandemic in the country, with less numbers of cases and deaths recorded daily relating to COVID-19. Things seem to have improved, but this led to what most leaders regrettably call a period of complacency.
Commentary against issues like we are super Melanesian race, and our sort of gene super prone to resist COVID-19. All these sort of things have been going on for the last 1 year. By the grace of God, we've been spared sort of controversy of what happened in India and other places. It's now catching up on us. Just to impress on us, we all need to step up.
Soon after the complacency period, with major events seeing mass numbers of people gathering in various parts of the country, a significant surge in cases and deaths was reported in Goroka, Eastern Highlands Province, sparking threats especially to neighboring Highlands provinces. Similar spikes in case numbers and deaths have also been experienced lately in the main centres of Lae, Mount Hagen, Medang and the capital Port Moresby. Eastern Highlands and Western Highlands provinces have declared lockdowns in recent weeks to prevent further transmission and infection between provincial borders. Other Highlands provinces who share the same highway are on high alert, ramping up on testing and vaccination efforts. Shortage in oxygen and health workers at major hospitals has also become a concern. Looking at provincial tallies based on information from the National Control Center this week, the National Capital District has the highest number of recorded cases and deaths, followed by provinces like Western Highlands and Eastern Highlands after the latest spikes. This subsequently became a hot topic on the floor of Parliament when it resumed for a 3-day sitting from Tuesday to Thursday this week, with a few MPs also sharing their near-death experiences with COVID-19 in recent months.
Shortage of oxygen in Eastern Highlands and also in most of the hospitals throughout the country. And also the beds are overcrowded. My supplementary is this, Mr. Speaker. What have you done as the health minister to prepare the country for such situation? Where have all the COVID funds gone to?
Question Blomium also, firstly, Mr. Speaker, outlaws of 245 la die. Amasla all sla die all fully vaccinated. Now still diet. Na amasla only no kiss infection or then only die.
My biggest question is this, Mr. Speaker. How did Delta variant hit Eastern Islands? I don't know how I'm coming settle province from. Within the month of 7th September, just weeks before September 16th celebration or Goroka Show, within this month, a week before that, we were hit out by this COVID-19.
The community transmission that's happening right now is due to huge gatherings within our country, and we have the evidence that after the funeral of Sir Michael Thomas Amare, the spikes went up. After the gatherings in Goroka, the spikes went up. So we have evidence that the community transmission is done when there's huge gatherings. The second question is, one of the questions is about the treatment. There is no treatment for the COVID-19 Delta variant.
PNG's premier research institutions, such as the PNG Institute of Medical Research and the National Research Institute, have supported the government's decision to roll out COVID-19 vaccines in PNG, with the PNG IMR recently making reference to AstraZeneca, saying there is overwhelming evidence that the COVID-19 vaccine has undergone rigorous testing in various clinical trials and in populations that have received the vaccines. Adverse effects monitoring has been proven to meet internationally agreed benchmarks for safety and efficacy or the ability to protect from disease. Other vaccines in use in the country at present have also been given similar approval and support by health authorities.
COVID's come in waves, hasn't it? It's come in this first wave that we saw in the beginning in 2020, and then we had another wave in August, and we had another wave in April this year. But now we're faced with this Delta strain, which is much more virulent and much more contagious, and we're seeing more people present to hospital, and sadly we're seeing more people pass away from the COVID disease.
It prevents people from getting critically ill, it prevents people from being hospitalized, and it prevents people from getting severely ill, and it prevents people from dying. So even if you are vaccinated, if we don't achieve the 70 to 80% coverage of vaccinating our people, we will not. That's when you achieve herd immunity. We are not there yet. So even if you are vaccinated, you still have to wear your mask, you still have to hand sanitize, and you still have to physical distance. And let me also give this advice to people who have not made up their mind. Please get your vaccines.
Given that it is also spiritually and socially related, various church groups in the country have been split on the issue of vaccination. Some Christian professional groups have also raised concerns on the no jab, no job policy, so as some workers' groups protesting. The PNG Health Workers Christian Fellowship held a week-long conference at Kujip Hospital Compound, Juwaka Province last month, having discussions on various issues, including COVID-19. President Rachel Poyer briefly shared her views on it.
Your God will protect you because God protects His own. But those of you feel that you wanna, we support you as well because you have the free will to choose. Some of us have already laid our life because we have come through cancer, we have come through polio, all kinds of sicknesses has bumped us. We work in the hospital, we touch those things, but God protected us. And we believe that in COVID-19, He still protects us.
Other professional groups have also raised concerns on the enforcement of the vaccine on employees in the private and government sectors, describing it as unfair and is a violation of their human rights. The Ombudsman Commission has also provided the opportunity for affected employees to submit complaints to their office if they feel being treated unfairly through vaccination-related issues. Government MPs had a vigorous debate over this in Parliament this week during grievances debate, with government maintaining its position to ramp up its vaccination rollout in the country to enable normal business to return at the earliest and also fully open up international borders, which is also the intention of other countries around the world, particularly major economies. Authorities say this is also aimed at providing workplace safety and some form of immunity against COVID-19 severe disease. PNG has a very low rate of immunization and vaccination from the past, not only for COVID-19 currently, but also for measles, polio, hepatitis B, and others. It has some of the lowest rates in the world. And with the high hesitancy to the COVID-19 vaccines in the country, there are concerns on whether PNG will be able to totally open up quickly for business again in the short term. Given the rapid spread and infection of COVID-19 around the globe, the production, distribution, and administration of vaccines has been fast-tracked. In PNG, the lack of awareness on the vaccines has also been identified as a factor to the high hesitancy rate among the PNG population.
Though we are saying if the frontliners should be getting vaccinated, but what about our immune system inside us already, God-given immune system that is inside us, that is fighting against all the other illnesses that is coming through. And that's the only thing that makes me feel that we should make awareness, more awareness to say that people should get vaccinated. Because the vaccine was not done how many years? No research was done for years and years to get the vaccines done. It's just when the COVID appeared, the vaccine appeared as well. So there's a fear in there. That's why many people are not wanting to get it.
New measures were announced by Pandemic Response Controller David Manning at the end of September as a result of the latest surge in case and death numbers, particularly with the Delta variant, for the whole month of October, restricting gatherings of people to 20 or less. This has forced school students sitting for final exams to do so under strict NUPLA passing protocols. The government has approved to build 4 new major hospitals in the country in Central Province, Southern Highlands Province, West New Britain Province and Hela Province at the earliest as part of improving health service delivery in the country. Other health infrastructure have also been promised for the long term. So vaccination numbers slowly rise significantly amidst some still unsure of their choices, whilst others in remote parts of the country remain unreached by vaccine supplies and awareness messages. How soon can PNG open its borders and allow economic activity to be fully functional again? And what is the best approach for the country's pandemic response? These questions and more will have to be dealt with by the government and its stakeholders in the months ahead.